A key part of protecting is spreading the message about keeping children safe and building a culture of always acting in their best interests. Creating a safe space in sport for children is about facilitating an environment that ensures that our youth are safe from harm, abuse, violence, exploitation, and neglect. In this second webinar, in the Creating a Safe Space, Safeguarding Our Children in Sport webinar series, I am Sherone Simpson and will be your moderator for this session. This webinar is designed to discuss ways that stakeholders can contribute to child protection and safeguarding our youth in sports. It aims to formulate solutions designed to encourage everyone to do their part to keep sports safe. The Dry Face Media is proud to work with all our partners who are endorsing us to make this a reality. In this webinar, the panelists will speak for 15 minutes each. There are 3 presenters, and after the final presenter, we will be taking questions and answers. You can tweet to the @DryFaceJA or put your questions in the YouTube chat. We will try to answer as many questions as we can. Before I introduce our first presenter, let me just say that if any material in this webinar may cause a trigger and can potentially cause emotional, psychological, or negative effects on you, please feel free to exit the webinar and seek professional help or guidance from any professional organizations in your area. We know we are streaming live across the globe, and while I am here in Jamaica, there are several of you who are watching us from different countries, and we want this to be a positive experience for you. This webinar is endorsed by the Faculty of Science and Sport at University of Technology, Jamaica. Thank you all for joining us, and we have a dynamic set of presenters who will be sharing with us, and we will all leave this webinar with a lot of information. Our first presenter is the Chief Executive Officer of the Child Protection and Family Services Agency, CPSFA, formerly the Child Development Agency, CDA, Rosalee Gage-Grey. As a member of the executive management team, she has been involved in spearheading the strategic restructuring of the children's services in Jamaica, in keeping with the modernization plan and framework document. In August 2013, Mrs. Gage-Grey was appointed acting CEO and appointed in March 2014. She has since been providing strategic leadership and direction to the executive management team and the agency's 600 staff members, and providing policy advice to government on matters relating to child welfare and protection. Over to you, Rosalee.
Thank you to our moderator, Sherone Simpson, fellow presenters, Mark and Kari, other distinguished ladies and gentlemen, coaches, teachers, and our youngsters who might be watching us this afternoon. It is my pleasure to be sharing with you in this very timely forum. I bring you warm greetings from the Child Protection and Family Services Agency, and want to congratulate the Strategic Sports Consultancy for hosting another webinar in the series aimed at raising awareness of the importance of safeguarding children from abuse, creating a safe space, safeguarding our children in sports. I want to start by just giving us a brief overview of the agency itself and our work, and then I'll move into the matter of child abuse and what that is, and then we'll look a little at mandatory reporting as the law that governs our operations dictates. So we were formed in 2004. We had a merger in 2017 with the National Children's Registry, which was previously the Office of the Children's Registry. We operate with a vision, and it says Jamaican children achieve their full potential in nurturing environments and with full access to developmental and social services, supported by CPSFA, a collaborative, child rights-centered, results-driven, and technology-enabled employer of choice. And our mission is to contribute to the well-being of Jamaica's children by supporting those in need of care and protection through family empowerment, collaborating with service partners, and regulating alternate child services. And our core values spell I-CARE, and it's integrity, commitment, accountability, respect, and empathy. So we are guided by the Child Care and Protection Act of 2004. We're under the purview of the Ministry of Education, Youth and Information. We have offices in all 14 parishes, and therefore we are very accessible to the public right across Jamaica. We have over 50 children's homes which we regulate, and those are across the island as well. And we work closely with other partners, the Jamaica Constabulary Force, the Office of the Children's Advocate, Ministry of Justice, and other government entities. We have USAID and USAID as our international partners that we work with as we do this very important job of protecting our children. Our role as an agency takes us into several activities. We do intake, where we receive reports of child abuse, primarily through our National Children's Registry, but we do take walk-ins to our respective offices. We get reports through our school system. Guidance counselors, coaches, teachers do give us reports. We offer counseling services, and especially in this time in COVID, our psychosocial services are readily available, and people have been, and children have been accessing those services over these periods. We also do our court services, where children who are deemed to be in need of care and protection are taken before the courts for the court to make a determination as to who is fit and proper to take care of them. We operate the Missing Children and Under Alert system, where we work with the Jamaica Constabulary Force to bring our children home who might go missing for whatever reason. Just to give a background on the situation analysis of children in Jamaica and the level of abuse that we are seeing. So an estimated 800,000 children are in Jamaica, and it's almost 50-50 for 50% for boys and girls. On average, 10 in every 1,000 children are the subject of a child abuse and maltreatment reports. 79% of our children say that they witness violence in their community or at home, and 68 of every 100,000 Jamaican children are victims of violent crimes. Approximately 80% of our children expose some form of psychological or physical violence administered as discipline. And we receive approximately, before COVID days, approximately 1,200 cases of reports of child abuse per month. We have seen that number trending down over the period, and we are concerned about that, because we figure that because school is not in session or children don't have access to adults that they can make the reports. So we have been using community-based interventions to get those reports. Neglect and children exhibiting severe behavioral issues are the leading reports that we do receive. Bullying is a significant issue, and as we talk about sports and children in schools, 6 in 10 children have reported being bullied, with close to 70% occurring on the playground or inside classrooms. So this is an area where coaches and other persons who are working with children in sports would have to pay some attention to. And approximately 6 in 1,000 children are in the care of the state. And we have over 4,600 children that comes under our direct responsibility. So the rights of children are entrenched in the United Nations Conventions on the Rights of the Child. Jamaica ratified that in 1991, and it details the rights that children have. The convention articulates the basic human rights to be provided to children under 18 years of age, and it's based on the right to life, right to survival and development, and the respect for the views of children. And these are embodied in our own Child Care and Protection Act here in Jamaica. This act defines a child as anyone under the age of 18. The CCPA strengthens the care and protection of children by introducing new standards for their treatment. It brings under one umbrella measures concerning children which were previously in the Juvenile Act. Every adult has a main responsibility under the Act to make a report if they know, suspect that a child is being abused or that the child is in need of care and protection. This duty to report applies whether you're certain or not. Even if you suspect that something is happening, you don't have to be sure. And the law provides that if you report in good faith that you suspect something is happening, then that report is taken as such, and you're not subject to any liability should the report not be so. The maximum penalty for cruelty to children is $1 million. It's very important that we report, because as a village who raise our children in Jamaica, we want to make sure that all our children have a responsible adult who would look out for them if they see or suspect that they are being abused. So what is child abuse? It's any act or failure to act on the part of a parent caregiver which results in, unfortunately, sometimes death, serious physical abuse, emotional abuse, sexual abuse, or the exploitation of the child. And there are various types of abuse. The most prevalent ones we're seeing: physical abuse, sexual abuse, emotional abuse, neglect, trafficking, child labor, and child pornography are some of those that we are seeing in Jamaica. It's important, especially in the field of sports, for us to know the signs of abuse and what to look for. We interface with children on the field, within the school context, or within clubs. What are those signs that we are to look for? Unexplained bruises or welts or burns, and sometimes if it's a burns, it would resemble the object. If you use an iron, you'd see that print, whatever. And so we have to look out for these signs. Children who might be taking drugs, you might see signs of bites, injuries, or some injuries can be healed. You see the scars. The children who might just be withdrawn, not participating, so they were active in sports and they just not come into practice, or you're not seeing them, something might be happening there. They fear adult contact or is repelled by physical touch, you can't touch them. Constant tiredness, not sleeping, they come to class and they are sleeping, or they, not there in presence in the situation. Sudden drop in performance. So they were a good athlete, used to come to practice, would go through all the routines, but all of a sudden they are not able to do it and exhibiting signs that they are not well. Nervousness or aggression. And we sometimes see this in the sports activities. Signs of depression, begging, stealing, not having sufficient food to eat, and frequent absence, and inability to concentrate or to understand simple instructions. So there are some signs that we look out for in children who are being abused. Who is a child in need of care and protection, which is our primary responsibility. And it's a child who has no parents, means child is abandoned or not parents have deceased, having no parent or guardian to take care of them, so they come to school unkept, not able to get proper care. Have been physical, mentally, or emotionally abused, victims of violence, perpetrators of violence. Unfortunately, we have children who perpetrate violence on other children. Bullying, we mentioned earlier. Child labor. The law doesn't permit children under the age of 16 to be employed, and even those between under the age of 13, sorry, and even those between 13 and say 16, it's specified duties that they can carry out under the laws of Jamaica. We work with the best interest principle of the child. And this principle says that children are entitled to protection from harm, from abuse, from neglect. Family is a preferred environment for them, and that's for their upbringing. And so in our efforts, we try to keep children within their family. So if a report of abuse comes to us, we try not to take them. We try to work with the families to restore them so that they can take care of their children. The respect for the views of children and in child participation. This is something in Jamaica traditionally we don't think, children should be seen and not heard. So we don't get a feel that children have a voice. And sometimes in the sporting arena, it's the coach's word. The child can't have a say. Parents want them to do this sport, and this was my dream, and I want that dream to be yours. But this might not be the child's dream. And so, as children mature and can take part in the decision concerning them, then they should be allowed to help with those decisions. And decision related to children should be timely, which is why we want to get those reports early so that we can do early intervention so it can prevent long-lasting impact based on the trauma that they would have suffered. So we move now to prescribed persons. The law, the Child Care and Protection Act, indicates some professionals who have a duty of care and who are mandatory porters. These are your health professionals, persons in the education profession, the teachers, guidance counselors, dean of discipline, the coaches, anybody like that within the school system, social workers, persons in the early childhood sector, all other persons who work or have a duty of care to a child. So if the child is entrusted to your care, you have a duty. And the law also makes it, apart from these prescribed persons, any adult, any person who knows, suspects, or that a child is being abused, have that duty to report to us. The obligations are to call into the numbers, go into the office. There are prescribed forms for these prescribed persons to complete. The law requires that each entities, whether this is school or the health center or the hospital, should have these forms readily available. We have them, we can make them available to persons to make the reports. We do take calls. We have a WhatsApp number that calls can be coming to, and we use that to make the reports in, and we can respond to them accordingly. Benefits of sports to children. There is a right to recreation, and more so now, sports is not just recreation, it's career. People have made their livelihood from sports, and it's becoming more important in that regard. And therefore, it's important that children are brought up in this atmosphere where that they see the need to participate in these activities. It helps with their cardiovascular functions. It helps in their growth and development. It's the mental health benefits, especially now that most of these sporting activities, physical sporting activities, are not taking place. What impact that is having on the children at home? How are we still able to engage them in those activities? It's very important because it helps with their mental development, team sports, the whole positiveness of team building and those matters that has to do with interpersonal skills. The rules that they have to abide by in these sports help to build their character and develop them in that way. And so it's very important. So we really are concerned about the children's lack of physical activity now that they are mostly homebound. It improves their social and personal skills, and it increases their levels of energy. And some might say we can't manage the level of energy that they might have, but it also helps them to exercise and get rid of some of those energy so that when they get home, they get to sleep comfortably. And so as we, in child protection, we say that as coaches, as teachers, as club managers, as persons who work with these youngsters, we have to ensure their safety within the confines of the sport that they are engaged in. We are saying permission should be had from parents for these activities. We believe that there should be medical checks done. You know, the forms that they would probably complete when they are signing up for these programs should indicate, do they have any allergies, who to contact if there is an emergency, do we have first aid kits at the sessions, medical practitioners on call, do we have nurses and persons like that who can provide immediate attention should something happen there. Are children sensitized to matters of child abuse, for example, so that if they know if one of their fellow athletes say something to them, they know how to report that. We understand that sometimes there's a lot of peer pressure there with the use of social media. We have been seeing an increase in the number of very insensitive material being passed on social media of children themselves or of adults with children, and we believe that this is something that we have to guard against. And other signs, and I want to talk a little about bullying and how this play out. So in schools, you have the famous track star or the football player, and some amount of bullying happens to other children who may not be so academically who are more academically inclined than sports. And so we see this playing out there, and we are encouraging coaches and persons who have that interest to look out for these youngsters who will suffer in silence because they are fearful of reporting. And even though our high achievers in sports sometimes use this to cover and to clothe the things that are happening to them. And so we have to be sensitive to that as well. And so I think at time or almost that we are to report. We have a toll-free number, 88-PROTECT. That's 888-776-8328. We have a WhatsApp that you can send texts and pictures and stuff to. That's 876-878-2882. And you can email report@childprotection.gov.jm or our social media pages, Facebook, Twitter, Instagram, YouTube, at CPFSAJM. And you can contact us and we will surely be willing to respond. We are also free to come and do presentations within the school space or other clubs and activities that you might have. Thank you so much for listening, and I'm available for questions at the end. Thank you.
Thank you so much, Rosalee. It is very important that we look out for the signs of children who are being abused. Remember to subscribe to our channel to always be in the know about our upcoming events and new episodes from the Drive Face podcast, please be reminded that we'll be taking questions after our last panelist presents. So tweet your questions to our panelists to @the Drive Face JA, or you can post them in the YouTube chat. Please remember, yes, in the YouTube chat. Up next is researcher Dr. Kari Fasting. Dr. Fasting's research has been concerned with various aspects related to equality and diversity in sport, with a diversity in sport. Based on her research and projects in Norway, Czech Republic, and Greece, she has published extensively internationally in this field. Her work has been applied to programs internationally for preventing sexual harassment and abuse from occurring. Her latest studies have recently been carried out in Southern Africa under contract with the Norwegian Olympic, Paralympic, and Confederation of Sport, NIF, assisting them in a project regarding increasing awareness and understanding of gender issues in sport. Kari, over to you.
Thank you, and good afternoon, everyone. This is my last slide, so just 1 minute. I will go to the beginning.
That is okay, Kari. We'll give you a little time to sort it out.
I will go there. I don't know why it came at the end. Here we go. So good evening, everyone, or not evening for you, afternoon for you, but where I am, it's 11 o'clock or 11:15. I've been asked to talk about issues and challenges in safeguarding children in sport. And that's a huge title, and I could talk about it for a very long time, but I decided to talk about these points. I think it's a big challenge that we lack knowledge, both in relation to definitions and particularly research. I talk about athlete's voice, about the raising of public awareness, about policy focus, and at the end about education and training. So if we start on the first one, there is a lack of knowledge with respect to that people don't know what abuse is, violence is, different kind of gender-based violence, non-accidental violence. And I'm not going to talk about that now because the title is about safeguarding. But people also have different opinions of safeguarding, and there are actually no international accepted definition of this. But I show you what definitions that came from UK Sports Council, and also now I use of UNICEF. And they define this as child safeguarding is about keeping all children safe from harm, abuse, violence, exploitation, and neglect. But very important is that safeguarding children has both a preventive but also a reactive component. Ensuring effective policies, practices, and procedures are in place to limit harm to occurring, which is the preventive part, as well as having measures in place to report, investigate, and deal with suspicions and incidents. So all these are safeguarding. If we look at the lack of knowledge in relation to research, there are very few prevalence studies in a global perspective. There are very few studies on neglect, physical and emotional abuse compared to sexual abuse. There are very few studies on bullying and hazing, and there are few studies on the impact of abuse, both short and long term. There are few studies on children when or while they were children. And the reason I said that is that at least in Europe, the big studies we have about child abuse in sport is we have got information by asking adults if they can remember what happened to them when they were children. There are little knowledge about risk situations. We know from some studies that a risk situation can be to be alone with an adult for a child. It can also be in connection with traveling, but there are little research. We also know very little about the context and the perpetrator. The first studies we did, the coach was always the perpetrator, and the classic was the male coach, female athlete. Today, many years later, we know that the perpetrator can be a woman, but studies will also show now, and that is not only in Europe, also in Africa, that there are much more peer abuse than there are abuse from coaches, which says something about the culture of sports. There is little knowledge about the process of grooming and also about the bystander problematic. But very important for this theme is that there are almost no studies on the evaluation, monitoring, or impact of the different safeguards, prevention, protection initiative that we have seen taking place and are taking place around the world. They have to be evaluated because one has to know what works and what doesn't work. But there are some positive trends here. The Safe Sport International has appointed a research committee, which are replacing the Brunel International Research Network for Athlete Welfare. There is a new Center for Safeguarding and Child Protection in Sport at Edgehill University in UK, chaired by Mike Hartill. And there is an international research network on violence and integrity in sport, chaired by Tine Werterman from Belgium. And there are also some new reports which gives us new information. This one, the one at the top that you saw, is from Japan, and it's called "I Was Hit So Many Times I Can't Count." And it's a very disturbing report, just released a few weeks ago, about abuse of child athletes in Japan. And the one to the left of the screen is a large study published last year from Canada, prevalence of maltreatment about current and former national team athletes. And the third report is from European Union. It's a mapping study on safeguarding children in sport, which should take place I think it was 12 countries that participated in it. But there are other challenges. There are gaps in international structures and systems for coordination of cross-border investigations and criminal record checks. There are lack of international infrastructure to deal with banned convicted individuals moving across borders, intelligence sharing about individuals of concern by law enforcement agencies and sport. We know we can track them, that some of these abusive coaches, they just move both around in one country, but also across countries and across different parts of the world. There are insufficient resources into safeguarding and protection compared to other integrity issues, such as, for example, doping, match fixing, or gambling, and there seems to be very little connection between them. And there is a lack of consensus for poor governance, a lack of consequences for poor governance. Meeting safeguarding requirements needs a clear mandate. And of course, it's a challenge today for everyone, and also in sport and also in relation to safeguarding the impact of COVID-19. I have seen over the last years that athletes themselves have become much more active. In some sports, there are peer support networks. There are more media attention in relation to abuse and documentaries of abuse. And the one to the right is a Netflix documentary about the gymnastics and the gymnastic cases in the US. If you haven't seen it, you should see it, even though it's quite disturbing. There is high-profile criminal court cases where now former athletes are make very important statements, and there are an engagement of people with lived experience of abuse. In many projects now, I think it's important to include the voices of those athletes. With respect to policy development, we have seen a change in sport, that there is more focus now on child and human rights in sports. And there are also then other bodies who normally do a lot in these areas who are interested in sports. Center for Sport and Human Rights, World Players, Human Rights Watch, and different UN agencies. There are collaborations between countries and organizations, particularly in relation to international safeguards for children in sport. There are specialist child athlete protection agencies now. We see that in UK, in Canada, in Australia, and US Center for Safe Sport. And Safe Sport International now have a project group with the next speaker and myself, a member of, where we are trying to develop comprehensive, inclusive international safeguards for all. And the time is running, but I think I can manage to do my last points here, which is about education and training. The International Olympic Committee published a couple of years ago over 100 pages a toolkit, and that toolkit about safeguarding is made for international sport federations and national Olympic committees. FIFA is the one to the right there, have written one about child safeguarding. This is a toolkit for members of member association of FIFA. And there are international and national federations now that have online awareness training. One focus at the moment, many places in the world seem to be international designated persons training. FIFA is doing it, Council of Europe is doing it. IOC has just started a 3-year program where they will educate safeguarding officers. There is a project that will be released in a couple of weeks. It's a Eye Protect in Sport. It's a European club safeguarding online learning platform. And a couple of years ago, iCodes Kids from UK is a very informative project. And there is one from Council of Europe called Start to Talk. Don't look at that figure, but this is the Eye Protect in Sport. I just would like to say that it's a project for the development of an early learning online platform targeted at grassroots organizations, and with the participation of not only athletes, but families, coaches, and sport managers. Here is the first pages. If you will find it on the web in a couple of weeks. And here is the first page for the ICK, also iCodes Kids, that also you can access already now. Start to talk. My last slide is the Council of Europe call for action to public authorities and the sport movement to stop child sexual abuse. And Start to Talk is about adults breaking the silence and lending children a voice. Start to Talk has developed a little video, and I would like to end my presentation with showing you that video, which is put up from me with if the technician work in Jamaica. So thank you so far, and I will talk to you later.
Thank you, Kari. It is very important to see that with the Tokyo Olympics set for 2021, that IOC is creating a toolkit about safeguarding in sport. Thank you, Kari.
Did you see the video?
Yes, we saw the video, but we were not hearing.
Because I couldn't see it. Thank you.
You're most welcome.
Okay.
And it is very good to see that seeing the Tokyo Olympics is in 2021, that the IOC is implementing a toolkit about safeguarding in sport. Remember to tweet your questions for our panelists at the dry phase, or you can post them in the YouTube chat. Our final presenter is Mark Mungal. Mark is a director and co-founder of the Caribbean Sport and Development Agency, formerly known as the Trinidad and Tobago Alliance for Sport and Physical Education. Mark's core work is in the national, regional, and global sport and development sector, and include capacity building, policy development, and sport sector strategic planning with strong focus on the use of sport as a tool for personal, community, national, and global development. A key part of Mark's work is the safeguarding and protection of children in and through sport, working with UNICEF and other partners to develop safeguards for children in sport. Over to you, Mark.
Thank you, Sherone. I'm going to do my screen share here, so let's hope this works. Here we go. Again, yeah, I think it went all the way down. Are we okay there? Are we seeing that screen? Yeah. Okay, and I'm putting my timer on as well. So first of all, thanks a lot to Dalton and the Dry Phase team for inviting and for organizing this. Really good on your part, and really good work that you're doing. I listened to the presentations of my two colleagues from before, and a lot of things already said there, so we might have some overlap. I'm going to just quickly say a little bit about the organization. Ooh, nothing is happening. Oh, there we go. A little bit about the organization that I'm representing. So I'm representing the Caribbean Sport and Development Agency. We are a sport for development organization, and just a focus on using sport as a tool for development. A lot of the work that we do is focused on outcomes related to education. How can we use sport to enhance education, social cohesion, inclusion, health, and similar types of outcomes. We work across 14 CARICOM member states, and a lot of it in collaboration with a lot of really valuable partners over the years. And just to note, in Jamaica, we worked there with the Ministry of Sport. We've worked with the Jamaica Phys Ed Association. We've worked with the GC Foster, although that's been some time back, and with some youth-led organizations that operated under the Caribbean Healthy Lifestyle Program. So we do have a working relationship with Jamaica. Over the years, we focused on three main target populations: children, young people, and persons with disabilities. In the very early days of the organization, we worked a lot directly with these target populations, but as we evolved over the years, we started to focus on the next level. So we will now work more with the teachers and the coaches, the administrators and the volunteers who support these target populations, with a strong focus on enhancing their capacity to support the delivery of programs, but also strengthening the institutions that they work with. Today, we're talking about sexual abuse in sport, and just for me and for many of us, this is a really complicated phenomena with lots of understandings and misunderstandings and different interpretations of the terminology. What is sexual harassment? What is sexual assault? What is grooming? And all of those other things. So for the purpose of this presentation, I want to just think about that we're talking about the entire gamut. So everything from that sexual harassment that would include things like texting and inappropriate messaging, sending images, etc., to inappropriate physical contact, and all the way to the other end of that continuum with sexual penetration and so on. So we're talking about all of those things, and we're not going to get into the details of all of the terminology. I think both the previous speakers addressed some of that in a little bit, but we do talk about this in detail in some of our workshops. So when we do a basic workshop around safeguarding and protection of children in sport, we address some of the things around sexual abuse. So it is complicated, and I think I guess the other thing is that to think about it as not an event, but as a process. And the literature suggests that there are two ways that we can do that: looking at it on the continuum, and also looking at it in terms of three broad categories that interact with each other. The perpetrator, and think about the perpetrator potentially as someone who may be powerful or desirable or influential. The victims, and the victims tend to be vulnerable, potentially vulnerable. And then the environment, and those environments, and that sport environment that can create risks for children in particular. And again, some references were made to that. Think about traveling, for example, for away games. Think about children who have to attend Junior Olympic Games or any other age group tournaments when they have to fly out of country, fly out of Jamaica to go for Caribbean youth games in another country, etc. But also just the environment that is the change room facility, and transporting children from home in the privacy of somebody else's car, etc. So we look at those three interacting things as well in the context of sexual abuse. And as I said, for the purpose of this presentation, we're not going to get into the details of that, but accept that when we talk about this for today's presentation, we're talking about all of it, the entire gamut of sexual abuse. And so we do know, and if we've had Kari on board, and Kari is one of the pioneers of research in this field. And so we do know that we have a problem. So this is not something that we're making up. This is not just based on anecdotal stuff. We've had research in this sector that tells us that, yes, we do have a problem. And for us now, we need to figure out, well, what's the source of that problem? And I'm going to reference a couple of studies. Two of them are European studies. This one, and in fact, Kari is a co-author of this study done out of the UNICEF Innocenti Research Center. And that study was looked at a few European countries, and protecting children from violence in sport as the main heading. I pulled out three key things that I think are applicable for us, well, globally, but certainly here in the Caribbean. And one of the findings was a lack of effectively functioning structures, policies, systems at the organizational level, at the national level, and at the international levels. And again, Kari referenced some of this in her presentation as well. The second, and it's still, even though this is 2010, that marked absence of data on violence against children in sports, so it's still a huge gap. And the third point coming out of the third theme emerging that I want to share for you is the idea that good practice in sport for development initiatives, as sport for development initiatives, can provide a vehicle to promote safeguarding and protection of children in sport. So this is not just sport initiatives, particularly not necessarily competitive sport initiatives, but sport for development initiatives. That's the type of work that we do where we use sport as a tool for development. So those three things, and keep that in the back of your mind. The other study is out of, was one that was commissioned by the NSPCC, that's the National Society for the Protection of Cruelty Against Children. And the NSPCC has probably the best known and certainly credible organization. Their Child Protection in Sport unit is one that is our go-to unit for education and for resources and for guidance. And so they commissioned this study, and it was done by the University of Edinburgh back in 2011, looking at the experiences of children participating in organized sport in the UK. And again, I pulled out of it three emerging themes that I think are all relevant to our context here. One, a negative sporting culture exists, is accepted as the norm, and is perpetuated by peers, coaches, and other adults. And that is so I think the first speaker referenced the things that we accept as the norm in our Caribbean culture, in Jamaica, but across the Caribbean. One, for example, that we don't give children a voice in the sector, but also other things, the way we speak to them, that we shout and yell at them in that sport environment, that we wouldn't do it in another environment, but we do it in the sport environment, and it's not looked at as something that's not accepted. It's just a norm. It's okay for a coach to yell and scream at an 8-year-old child for a mistake on the football field or whatever it is, or for their perceived poor performance. And and it's considered the norm. It's okay to be violent, and in fact, if children go in for a hard tackle, it's seen as something that's part of the sport culture. It's seen as something as just a part of what is accepted as the norm. So that's one of the things, and it's a very negative element of sport, and it's relevant to us in the region here as well. The second is that young people in the study reported emotional, harmful treatment and unaccepted levels of sexual harassment. And again, that came out of a previous presentation as well. And interestingly, that peers were the most common perpetrator of all forms of harm reported in this research. So we often, because of what's in the media, we think that the most common perpetrators are the coaches, but the study suggests that the most common perpetrators of all forms of harm were from peers. So those were two European studies, and we do have some research from the Caribbean that I'd like to share as well. And this one was commissioned by our organization, the Caribbean Sport and Development Agency, and done by the Brunel University. I think we were lucky to have Daniel Ryan and leading this, and Professor Brackenridge, who herself is also considered to be the pioneer of research in this field. This was done with just 3 of our Caribbean countries, and some of the things emerging from that study. One, and this was 2014. One, as with the European studies, that absence of frameworks, of national safeguarding frameworks, the absence of safeguarding policy in sport, the lack of systems, and particularly systems to manage cases. So even now, if something happens within the sports context, who do we report to? And Kari referred to the establishment of designated safeguarding personnel as a new initiative that we're pushing globally as well. The need for further training in the identification and management of abuse, and the lack of organizational integration. So these things that are similar themes emerging in the Caribbean. And I think the point I want to make here is that even though we are maybe considered to be less developed and we have our own cultures and context here, there are some things that cut across. And you see this issue of abuse of children, it respects no culture, it respects no region of the world. And so a lot of the things, there are lots of things that are relevant across different boundaries. And then we did one other study, and this one was actually, we was not an in-depth, robust study per se. In fact, we use SurveyMonkey to gather data, and every time we delivered training, any kind of education programs in any of the Caribbean countries that we work, usually for teachers, physical education teachers, for coaches, for administrators, we would also administer this survey as a paper pencil survey. And these are some of the results. I'll share some more with you, but 92% of the survey participants had observed or were aware of emotional abuse occurring to children in their sports. 72% were aware of physical abuse, 47% for sexual harassment, 19% aware of sexual harm in sport. And I'll go through some of this very quickly, just to know that this is not this does not reflect the prevalence of abuse in any sport. This was actually just that the respondents were people from these different disciplines. And because it's the Caribbean, we'd have a lot of them from track and field, obviously, athletics, from cricket, football, netball, volleyball, which are the dominant sports in the region. So just a couple of the, and I'll go through these quickly. So as I shared earlier, that 92% of the participants had observed or were aware of emotional abuse. And this is just one of the questions that reflected that. And then who was responsible for it? Again, if you look at that there, children and teammates making up a significant chunk of that pie. One that's related to physical abuse, one of the questions related to physical abuse, suggesting that being forced to train when exhausted, how prevalent was that? And then again, who was responsible for that physical abuse? And we included a couple on drugs as well. And you know, and that's one of the things that we need to recognize, that all of this is also connected. So the sexual abuse in sport does not happen in isolation. So oftentimes it's intertwined and interconnected with other things that are happening that also challenge the integrity of the sports sector. And this last slide from the survey, we had a little more about that, the responses around sexual harassment and sexual harm. And then who was responsible? 40% were from teammates and peers, only 24% from the coach or trainer. So again, that is consistent as well with the findings from the European studies. So I share that with you just to say that we sometimes think that we're responding to something that's foreign to us. In fact, when we started our safeguarding journey in the Caribbean way back in 2002, we were visiting the different islands, working in collaboration with ministries of education and sport and so on. And sometimes people were, because this was not something on the agenda, and because we were supported by a lot of other global partners, they felt that it was something that was being imposed from the global north. The truth is that this is something that's quite relevant to us right here in the Caribbean. So we know it's a challenge. We know that there are some gaps in the systems. The question is, what are we doing? And so Kari already shared a couple of these that we're doing at the global level. So she mentioned the IOC kit, the international safeguards. It's a really, really solid, comprehensive guide for any individual or organization working in sport. It's available on the Sport and Dev platform. She mentioned the FIFA. So we have some things happening at the international level, but we also have some things happening at the regional level. So in the Caribbean, Cricket West Indies has been collaborating with UNICEF, the Eastern Caribbean office in particular, and they have done some amazing work with loads and loads of teachers, physical education teachers at the primary school level, introduced to basic safeguarding awareness as part of that kiddie cricket program. And that has great reach. And even better reach, we've now, over the last few years, working with CONCACAF and doing the safeguarding awareness for coaches. And again, that has significant reach. We're talking about 41 member states of countries. So think about the reach when you deliver a safeguarding awareness workshop in any of those member associations. And so that's already embedded in their D license, and we're now working to increase that and introduce it to the other coaching courses. I mentioned as well Fight for Peace, because I know Fight for Peace is, as a global organization, is doing some work in Jamaica, and they are also advocates and facilitators of safeguarding training. And I'll tell you a little bit more about the safe stamp as we go down. I wanted to just highlight the safeguards, this particular document, this guide, because it really is comprehensive, and it's every government, every sport association should have a copy of this and should be using it to help develop their policy and procedures for responding, how to minimize risks, guidelines for recruitment, etc. So if you don't have a copy of it, it's available freely online. Please get a copy and use this to guide what you do to help make sports safer for children. But here's a challenge. We're talking about sexual abuse in sport. And so, yes, we have some education happening, and we've been doing that since about 2004, delivering safeguarding training across the region, across 14 CARICOM member states, working with at government level, with federations, with clubs, with other organizations, etc. We've been facilitating development of policy, etc. But there's a huge gap still, and that gap, we are suggesting that if we really want to address this issue of abuse of children in sport, is the establishment of a system and specifically a registry. And so this is one of the things that we've been recommending. It's been a tough journey going forward, but essentially what we're recommending is that as long as you're an individual or an organization working with children in sport, that you must be part of this system. You must be part of this registry. And in a sense, now we are kind of regulating this sector. So any and every organization can't decide they're going to be working with children in sport. They have to be part of this registry. And for that, we're saying for individuals to be on this registry, you have to have, well, your coaching or physical education certification. You must complete your safeguarding training, that police background check, and a self-declaration. And then you become part of that database. And similarly for organizations, you have to have your safeguarding policy, code of conduct, so your coaches know what's good practice and poor practice, etc. We're focusing on establishing those designated safeguarding leads. So we now have someone who on staff or in your organization who's responsible for safeguarding, trained staff, and that is to say that they are also safeguarding trained, and then a reporting system. So your organization must have a system, and everybody must know, children and parents must know what's the system. And this is a starting point for us, and we are saying that as long as you're an individual and an organization working with children in the Caribbean, then you need to be part of this safe stamp system. So, and obviously not foolproof, but a strong step in addressing the issue of abuse of our children. And so finally, we understand, I think, that sexual abuse in sport does not happen in isolation. So if we want to address this effectively, one, continue with the education, and as was shared in previous presentations as well, there more and more of that is available. We have to commit to more advocacy and awareness, and we are investing in more survivors and athletes who are supporting that. We need to commit to the policy work, and our CARICOM member states have been sluggish in this. We do have now, I think, only 3, maybe 4, 3.5 who have committed and actually developed their safeguarding policy as part of their national sport policies. We have to commit to the research. We need to know what's happening. We need to be evaluating what's working so we know how to improve, etc. And finally, we need to commit to a system that ensures that as long as you're an individual or an organization working with children in sport, that you are part of that registry. And that means that you've met the criteria for keeping our children safe. All right, thanks folks. I'm sticking around for questions.
Thank you, Mark, for your presentation and also for partnering with the different organizations in Jamaica. The GC Foster College, I'm very familiar with that institution. And it is good to see that some work is being done at the regional level in safeguarding awareness. So thank you so much for that. We will now go into answering some of the questions that we have. And the first question is for Rosalee. How has the Jamaican culture influenced or interfered with your agency's ability to do any type of meaningful intervention?
I think culturally, if we could look at it from the perspective, say, of physical abuse, the statistics shows that a significant number of our children are beaten, pinched, and boxed, and within the culture. The government has given its commitment to ban corporal punishment in all areas. It's now banned in children's homes and early childhood institutions, but it's not banned in the homes. And that's a cultural issue that we have to be doing a lot of public education on. So that's one area. The other area is where there is this culture of a little sex and not taking sexual abuse seriously. Especially if the youngsters are over the age of consent and people feel that, you know, it's okay. Well, most of them would be coming under severe pressure to engage in these activities. So culturally, we see some hindrances, but we have been able to make some inroads through our public education, through our work with communities and schools, and we have seen some movement, but we are still concerned about the significant numbers of reports we still get of abuse of our children. But it's a task that we are up to, and we do our efforts to get the information, to build awareness, and to advocate on behalf of our children as they navigate.
Thank you, Rosalee. This question is for Dr. Fasting and Mr. Mungal. How has the pandemic impacted the mission to make sports safer for children?
Kari, would you like to go first, or you want me to go?
No, you can go first.
See, I always have to ask permission. You see, she's a senior academic here, so. It has been interesting and challenging. I think probably the most significant challenge is that for our education programs, we no longer have that opportunity to do the traditional face-to-face workshops, which is what we would have normally done in the past. But it's influenced us to start developing materials that we can use for online delivery, and I think that actually has lots of benefits as well. Better reach, much cheaper for us to do, cost efficient, etc. And it still gives us the opportunity to interact. So we use the platforms that are available. We can still have conversations and so on. But as a workshop facilitator, you know, I miss the engaging activities that generate, you know, depth of thinking, which is necessary when we engage in topics that are murky and that require us to dig into, when we have to get participants into scenarios and for them to really think through what are the decisions that we have to make in a particular scenario. It's much easier for us to do that in a actual workshop face-to-face setting. So I think the most significant impact for us in as far as the safeguarding work is concerned is the impact on our safeguarding education workshops and having now to shift to the virtual platforms.
Yeah, I agree in that, but there is also another aspect now of COVID-19, and that is the fact that in some countries and some places, the kids are not playing so much, or are more restricted, or maybe don't go to school at all. And what does that mean in relation to abuse? There has been at least, I haven't seen any study yet, but there has been writings about it, that in my own country, Norway, for example, when we closed down the school system, that vulnerable children that were in homes with which were risky in relation to abuse, that more abuse would happen to them. So that they had a system for a certain time where those where they have like activities for these children, so that they didn't need to be home and inside all the time. I think, like Mark was saying, that with respect to education, there are some interesting development here. But I think, of course, COVID-19 has had impact on the research. We would have had, I mean, you can still do online research, and you can do interview by Skype, but of course it's an impact on the research and on some of the projects that people would have done, which in which they would have had face-to-face contact. Yes, I think that's what I would say.
Okay, thank you. Mrs. Gage-Grey, is the agency able to make unannounced visits to school sports training pre-COVID, or do you have to get a report?
We do. We primarily act on reports that we receive, but we do work with schools and guidance counselors and can go in. Usually when we go in, we speak to the leadership, and of course that's the only way we can get to the children. So you might get a report of a case at a home or in the community, but most times we're able to find them at the school. And sometimes they want to speak to the children before we get to the parents, you know. And so we have, as the law gives us that permission to be able to go to that child and remand that child, or to speak with that child and then get the parents involved, especially if the abuse is in the home. If it's in the particular school, the children's advocate is the one who do those investigations. While we secure the rights of the child in terms of their safety, the investigation of the teacher or the state agent would be done by the children's advocate, but we do the initial safety precautions.
Thank you. Dr. Fasting, this question is for you. What recommendations do you propose for us in the Caribbean to help the different stakeholders with safeguarding athletes?
You know, I think people who live and work with this, also the two other speakers that are from Caribbean, should answer that. I don't have much knowledge about Caribbean, but there are things that are important to have in place, and that is, of course, a policy, an action plan, a system for reporting, so that if something happens to athletes, that there is a system how to that they can feel safe to report. And many places don't have that, this case management, also in other places of the world, because it doesn't help to have a lot of nice policy if that part is missing. And if so I think that's important, but I think that maybe the other people that are from Caribbean should answer.
Thank you, Dr. Fasting. Mr. Mungal, how can parents play their roles in preventing abuse of athletes in sports?
Look, the responsibility for keeping children safe in sport, whether they're athletes or just children who are participating in sport, is everybody's responsibility. And it's one of the things that we clarify when we do our workshops. So sometimes we think it's the responsibility of the coach or the welfare officer or the parent alone. It's everybody's responsibility. So that's a start. And if, as a parent, that's part of your responsibility, because as Rosalee indicated, you are in Jamaica and in several of the Caribbean territories considered as a person who has that responsibility for duty of care, etc. And then you have to know what are those things that make put your child at risk. And I shared earlier on those three interacting things: the perpetrators or the potential perpetrators, the child, and the environment where they interact. And as a parent, if I understand that, then I'm going to be careful about the environments that I allow my child to be in, to lower that risk of the child being abused or the child athlete being abused. So simple things, for example, how do I get home after a training session that finishes when it's dark, and it's not easy for me to get public transport, and there I have to then be dropped off by a coach, for example, in their private vehicle. does that put your child at risk? And if they understand that, because the potential for somebody who has power and influence over the child or the child athlete and the environment that they are in that one-on-one space in a vehicle traveling, especially if it's a long drive to Montego Bay. And then the child athlete, especially if it's an adolescent athlete who is very vulnerable, because especially if they're a high performance adolescent athlete who would not want to do anything to get on the wrong side of that coach. So as a parent, I think it's about education as well. And some of the organizations deliver those education programs for parents around safeguarding so that they understand some of the, and I'm giving you a kind of nutshell looking at those three broad categories, but they need to understand all of those things so that they can better avoid the risk, minimize the risk, mitigate against the risk to safeguard their children.
A follow-up question for you. Do you think we're doing enough in the Caribbean, or there is more talk than action?
Listen, you don't want to start me up, Sherone. So I've been literally bouncing my head against the wall with CARICOM, with the OECS, with member states. So this is every year for the better part of a decade, sometimes twice for the year, bringing together directors of sport. And every year they would make a commitment to say, yes, we're going to develop our policy and so on. And as for now, as I shared earlier, I think we have Anguilla, Guyana has recently done, St. Kitts and Nevis has recently done, but several of the member states from our region have not even developed their own policies from a government perspective, or at least embedded in their national sport policies a core reference to safeguarding. And I'm not talking about a superficial mention of it. I'm talking about policy statements and policy guidelines that guide decision-making for governments around safeguarding and protection of children in sport. And so, but there are some organizations and some individuals who are doing amazing work. And so in St. Lucia, the Safe Sport, Sacred Sport Foundation in Grenada, the Jason Roberts Foundation. And in Jamaica, I don't know if Kari's on this call working with that Fight for Peace project, and UNICEF and Cricket West Indies for years. So there are some agencies and some organizations that have been doing good work, and we need to recognize that and learn from them and support them and have more collaboration with them, so to expand their work. And as that 2010 or 2011 research that Kari co-authored recognize, sport for development agencies can play a role in supporting safeguarding. Let's collaborate with those organizations who are already doing that, because to a large extent, sport organizations, the national federations, have such a strong commitment to winning and participating in competition. This often gets, and as Kari mentioned, this is not one of the well-resourced areas. They spend money on anti-doping and now match fixing and all of that, and obviously on high performance sport in general, but there's not a lot of resource going to sport, safeguarding and protection of our children in sport. And yes, so not enough being done. Yes, some organizations and individuals doing some great work, but we have a long way to go on this journey.
Thank you. Kari, someone is asking, for the persons with disabilities, do they go with chronological age or development age in terms of research?
I'm not quite sure if I understood the question. In case of research, what kind of research? I mean, are we
from any research that you have done?
I think you must repeat the question, please.
For the persons with disabilities, do they go with chronological age or developmental age?
In relation to research on harassment or abuse or safeguarding?
Yes.
I'm not quite sure I understand, Mark, or do you understand the question?
Yeah, I think.
Yeah.
Yeah, I think just, I mean, one is that persons with disabilities obviously are vulnerable, but I think it's a special population in how we treat with them in terms of education and awareness, but also research. So in some cases, obviously, they're depending on what you're exploring, what they're studying, or the criteria may be development, and in others it may be age. So it would depend on the particular research that's being done. It's a special population that requires a lot of special understanding and all of that. I'm not an academic researcher to be able to tell you anything definitively, but certainly from any studies that I would have read around persons with disabilities within the context of safeguarding and child protection, I think there's less focus on that type of category and more focus on their levels of vulnerability.
Well, I know we know from other studies outside sport, and there is no reason not to think that it's also happening in sport, is that people with disability has an extra risk compared to others. I've done some work for the Blind Association in Norway, and studies outside sport shows that they have a higher frequency of harassment and abuse than able-bodied people. Maybe this is related to that there is a huge discussion in relation to disabled sport and the different classes and competitive sport. And that still exists, of course, both internationally and probably nationally. In Norway, I don't know if there are any other countries, but disabled sport is integrated in and is as part of the Olympic Federation. So it's called the Norwegian Olympic and Paralympic Federation.
Thank you so much. That is all we have for questions. Please remember that our next session in our webinar series will be on Saturday, October 24 and Saturday, November 7th. Follow our social media pages at the Drive Phase JA on Twitter and the Drive Phase on Instagram and Facebook for more details. Thank you so much to our presenters, Mark Mungal, Rosalee Gage-Grey, and Dr. Kari Fasting. We really appreciate having you, and you doing a great job feeding us with all that information. To all the participants who joined us, we greatly appreciate your support. Until then, stay safe.